I rise today along with my co-presenter, Councilwoman Raman, to acknowledge Ovarian Cancer Awareness Month, an important opportunity for us to raise awareness of this devastating disease. Ovarian cancer is one of the deadliest gynecological cancers, with almost 20,000 women in the U.S. diagnosed each year, and more than 13,000 who tragically lose their lives. Here in LA, we lit up City Hall and the LAX pylons in teal to honor those who have fought and continue to fight this disease and to help raise awareness. Ovarian cancer is often called the silent killer because there's no reliable early detection test, making it crucial that we continue to educate ourselves and others about the symptoms such as bloating, abdominal pain, and changes in appetite. Early diagnosis can often mean the difference between life and death, with a 93% 5-year survival rate for those diagnosed at an early stage. As we mark this month, it's important to remember that this disease touches so many lives, but we also see hope in research and efforts undertaken by people like Dr. Sanaz Memarzadeh, whose work at UCLA's Gynecologic Oncology Discovery Lab is changing the way we fight this cancer. And we see hope in the relentless advocacy, too, of organizations like the Ovarian Cancer Circle, inspired by Robin Babbini, who's founded by Paulinda Babbini in honor of her daughter, Robin, who lost her battle to this disease at just 20 years old. I'm honored to be joined today by Paulinda, her courage and determination to turn her loss into a movement that supports women and families impacted by ovarian cancer inspires me and should inspire all of us. So I'd like to invite my colleague, Councilmember Raman, to say a few words first.
Thank you, Councilmember Yaroslavsky. And I want to thank you for picking up the mantle from Councilmember Koretz, who actually organized this presentation before you. And for me, it was a moment of awareness and learning, because before I participated in this presentation, I had no idea about how widespread this issue was, and I had no idea about what kinds of signs could actually tell you that you may be experiencing ovarian cancer and that you should go get checked. And the reason for that, in my mind, is because this is an issue like things like UTIs or fertility issues that affects women, and therefore it sometimes can just go under the radar. It doesn't get addressed like other illnesses do. And so I think to take this moment and to lift up this issue, to make sure that we as women are armed with the information that we need in order to be able to address our symptoms and to go get that check early on that can save our life is so essential. So I want to thank you, Councilmember Yaroslavsky, and I want to thank you, all of you who are involved in this organization, because you bringing this forward ensures that we have a constant reminder that we need to be talking about this and that we need to raise awareness. I am also very, very delighted to be here with the Ovarian Cancer Circle, a nonprofit organization that we at City Hall are so proud to uplift. And I think for me to see your story, to see that you took a tragedy in your life and made it into something that would then help other women to take control over their own health, and to make sure that we had the knowledge we needed to be healthy. That, to me, is a story that has inspired me and has stuck with me. And I want to thank you for doing this, and I want to thank all of the women who come every year, and men who come every year to make sure that we are thinking about this, that we're underscoring this, and that we're reminding everyone in this room how to take care of ourselves and how to take care of the other women in our lives. So thank you, Councilmember Yaroslavsky, and everyone who's here.
Do I introduce myself? Thank you, Councilmember Raman. Now it's my pleasure to introduce Paulinda Babbini, founder and president of the Ovarian Cancer Circle, inspired by Robin Babbini. Well, I'll let you speak for yourself. Yeah.
Good morning. Thank you so much for having us here today. Thank you, President Harris Dawson, Councilmember Yaroslavsky, and Raman, and all you council members. As Councilmember Yaroslavsky said, my name is Paulinda Babbini. I'm president and founder of the Ovarian Cancer Circle, inspired by Robin Babbini. This is Robin, and she lost her life at 20 to ovarian cancer. Our family knew nothing about the symptoms or how to be proactive. If I had known then what I know now, Robin would be here today, I am sure. On behalf of the Circle and Dr. Memarzadeh, I would like to extend my profound gratitude to Councilmember Yaroslavsky and Councilmember Raman for their support and for this proclamation acknowledging September as Ovarian Cancer Awareness Month. A shout out to Jocelyn Tabata, who has worked tirelessly to bring this day to fruition. The Circle is most appreciative that for 8 consecutive years, the LAX pylons in City Hall have been aglow in teal, the national color of ovarian cancer. A special acknowledgement to former Councilmember Paul Koretz, who initiated the City Hall Council in recognizing this important day, and to Ali Samad, the Director of Communications, who joined us today. One of the fundamental pillars of the Circle's mission is raising awareness about ovarian cancer. We tirelessly work to educate women about the symptoms, risk factors, and early detection methods, as shown on these bookmarks. You all received one at your table. This knowledge can be life-saving. 2 of our survivors are here with us today, Flower Miller and Karen Gilman. They are the faces of hope that women can survive ovarian cancer. The Circle is extremely proud to commit its fundraising to the prestigious Geodiscovery Lab at UCLA, led by Dr. Sanaz Memarzadeh. Since the Circle's inception 13 years ago, we have raised over $1 million to support this her cutting-edge research. Dr. Memarzadeh is a physician, a surgeon, a tenured professor, and a scientist. This year, she has been successful in securing grants for over $4 million for research specifically for studying ovarian cancer. The funding will help to understand the cause of recurrent disease, which is what happened to Robin. She recurred 6 months after her chemo was finished. And it's statistically known that it reoccurs 80% of the time. It gives me great pleasure to introduce Dr. Sanaz Memarzadeh.
Well, thank you so much. It's a pleasure and honor to be here with all of you today. Thank you for that introduction. So as Paulinda mentioned, I'm a gynecologic cancer surgeon with a translational basic science research lab at UCLA. And the focus of my lab is to devise better treatments for women who are impacted by ovarian cancer and some types of uterine cancer, which can act quite aggressively as well. I want to just give you some statistics. It's estimated that the lifetime risk of ovarian cancer is about 1 in 87, and endometrial cancer 1 in 33. There's actually a very acute rise in the rate of endometrial cancer as well. So it's a disease that, as a woman's cancer, I think needs attention. As a physician scientist, I am really struck by how underfunded and as a result understudied many of these gynecologic cancers are. And I wanted to talk about that in this month, which is Gynecologic Cancer Awareness Month. There's a big discrepancy in funding to fatality ratio of these tumors. And this is particularly concerning because some of these cancers actually disproportionately impact women who come from historically underserved communities. So this is an area that needs attention, in my opinion. My team, my collaborators at UCLA and I are trying to change this trajectory. We're performing transdisciplinary research. We're partnering with the community, with organizations like Paulinda's organization, which has done a tremendous job, with you, City of Los Angeles here, engaging patient advocates, and prioritizing diversity in research. But there's still much work to be done. The health disparities in gynecologic cancers are massive and actually multifactorial, and I just wanted to take a minute to talk about this. I think Councilmember Raman alluded to this. But from a gender standpoint, there is really less funding, and there's a stigma in discussing women's cancer. Women's cancers, we know that. From a racial standpoint, there is less recruitment of women who come from underserved populations to clinical trials. There are also inherent differences among some of these cancers among different populations, and there's much biology here to be understood. And from a socioeconomic standpoint, there's unequal access to care, insurance, and in some cases, knowledge and education. So how do we change this narrative about these below-the-belt gynecologic cancers that are both underfunded and also understudied? So I'd like to make an announcement to call into action. We need to partner with organizations such as the Ovarian Cancer Circle Inspired by Robin Babbini to increase awareness, and Paulinda and her team are doing that. We need to educate, we need to raise vital funding for this area. We also need to do innovative and collaborative research. We need to end systemic bias. We need to be mindful of diversity and inclusion in research and also in clinical trials. And we also need to retain the individuals who are doing this research. In many cases, those are women scientists. So I appreciate your attention to this important topic, which is, of course, near and dear to my heart. This is my life's dedication. And I do think that together we can change this trajectory. Thank you.
Thank you very much, Dr. Memarzadeh, Paulinda, for your incredible work and dedication on this really important, oft-overlooked issue. So without further ado, I'd like to co-present this resolution.
Hold on before you co-present.
Oh, I was going to, yes, okay.
We have a speaker on the queue. Councilmember Hutt.
Yes.
Thank you, Mr. President. I just want to thank Councilmember Raman, Councilmember Yaroslavsky, and the whole team that has come together year after year to remind us about women's health, about ovarian cancer, about early detection, and also about the disparity gap in funding. I appreciate it. I hope that we in the city will amplify your message and really work to protect our girls, our children. Thank you.
Councilmember De Leon.
Thank you very much, Council President. Paulinda, again, welcome. And Doctor, thank you so very much for all the incredible and strong, powerful women that are here today. Council members, Yaroslavsky, as well as Raman, thank you very much for this co-presentation. And once again, highlighting, if you will, as what was mentioned a few moments ago, a silent killer. Unlike breast cancer, that we have done such incredible outreach and education, where women themselves are checking themselves for lumps, anything that's not normal. Ovarian cancer, as we know, oftentimes is caught not in the first stage, not in the second stage, not in the third stage, but in the final last stage, the fourth stage. And I know this, as you all know, as I've shared my story, my mother died from ovarian cancer. And when she died, when you're younger, you don't realize, when you grow with age, you realize the age of 54 is just so young. And not knowing what it was, not understanding it, and being in college at the time, and leaving college and coming back home, and going through the surgery. We got 95% of the cancer, taken out. But within a year, it was so aggressive. She succumbed to ovarian cancer. And the point that the doctor just made a few moments ago, among women of color, Latina women and Black women and Asian women who perhaps don't have access, don't have an HMO or PPO. Their health care is, the ER room and whatever indigent care is provided for folks. And then just the toll it takes on the family, the psychological impacts it has, especially because it happens to women. And in this case, being the son of a single immigrant mother, she was the mother and the father. She was a caretaker. She was everything in the house. So she was the pillar. So when it takes down the mother, the whole house is destroyed. And that say when if you lose a father, if you were lucky enough to have a father at the house, that if you lost a father, that's not tragic, that's profoundly sad too. But when you don't have a father and you only have a mother, and then she disappears, she's gone at the age of 54. So the impacts are, it has a huge impact on the entire family. So I just want to thank you very much for what you do on an annual basis, just highlighting, educating, and it's hope that research centers, whether it be Hope or, Cedars-Sinai, UCLA or Cal or MIT or Harvard or Sloan Kettering, Mayo Clinic, wherever it may be. And if it's not here, it's some other place in the world, that they do find that cure, or at least find, some sort of combination that will slow down, the metastasizing, the acceleration of these cells. But you're right, it's a silent killer. You don't find out until the last stage, and I'm really, really just honored that you worked so hard, tirelessly, because of Robin, and at the young age of 20. So from the bottom of my heart to each and every one of you, thank you very much for what you do every single day. And you come here once a year, but you're not working once a year. You're working 365 days out of the year to educate, and hopefully we can get that cure for ovarian cancer that struck down so many mothers, so many grandmothers, so many sisters, so many aunts. So God bless you. Thank you very much.
Mr. Lee.
Thank you, council members Yaroslavsky and Raman, for bringing this presentation to us today. I'm in a family with 3 female survivors of different types of cancer, and you can't stress enough that early detection is the key. My own mother, because of her 2 sisters were detected, found something at a very, very early stage, and now she's been a survivor for 20 years now, living without it. I appreciate, and this presentation has inspired me to make sure that we put in our newsletter more attention to make sure that we are, not only like the self-examinations that you can do, but just to make sure that you are getting the proper examinations, knowing what to ask for when you see your doctors. So both council members, thank you, and all the ladies up there, thank you so much.
Thank you so much, Mr. Lee. And members, Councilmember Yaroslavsky.
Thank you so much, colleagues. So I'm now proud to, with my colleague, Councilwoman Raman, present this resolution to Paulinda Babbini in honor of the tireless work of the Ovarian Cancer Circle, inspired by Robin Babbini, and their efforts to raise awareness, support those affected, advance research, and make sure that we prevent as much of this as possible by raising awareness and education. So thank you for being here.
Thank you.
Thank you so much. Another big round of applause.